This is the world of the campus vets.
He's developed a very dry cough. I'm afraid that that has something to do with his heart.
He has a puncture wound just above his knee on one leg. I'm a bit worried about it because I think there's something in there.
It's painful and it can make them very, very ill.
At the Western College of Veterinary Medicine, students in the teaching hospital cope with a host of medical emergencies under real-life conditions.
This is Pam, named after my sister, I guess. I don't know if my sister will be happy about that, but that's who she is.
Pam the dairy cow has stopped eating, and owner Grant Gunter fears she's in pain.
She has been milking over 100 pounds a day in the last month. Until just recently she just went off feed and just started getting sick.
Pam had a calf 6 weeks ago, and Grant suspects the pregnancy may be related to her illness.
When a cow has a calf that's over 100 pounds, that leaves a lot of room inside them for things to go wrong.
For student Michael Tiggeler, Pam's foaming mouth is an obvious clue to her problem.
If she was a healthy animal, you may not see her salivating as much. Her stomachs aren't working as they should.
Cows have 4 stomachs, and Michael can tell just by looking that one of Pam's isn't where it should be.
One of the 4 stomachs that they have, the abomasum, it can get displaced either to the right or in some cases to the left. Now, it can cause an outpouching like we're seeing here.
The team decides that surgery is the best option.
I've heard of exceptional case where a cow has managed to roll over somehow and it's corrected itself, but generally it doesn't. You need to have the surgery performed.
For 15 years, Tucker has been a loving and loyal family dog. But a year ago, he was diagnosed with arrhythmia, an irregular heartbeat. Recently, his owner, Marge Shoemaker, noticed what could be a sign of impending heart failure.
He's developed a very dry cough, and that worries me. I'm afraid that that has something to do with his heart.
And we're gonna go see the doctor, hey?
Worst case scenario is to have them say that he's in heart failure. To lose him is going to be devastating. He's very special to me.
He gets even more and more nervous as he gets closer.
Tucker's no stranger to the college, but this is student Diane Chandler's first look at what could be a complicated case.
We frequently just get these cases on short notice, and it's hard to come downstairs after rounds and find I have a cardiac case that's coming in that has a file 2 inches thick.
Your main concern today is that he's started coughing again?
Yes. Whenever you hear of a dog that you're treating for a heart condition that has developed a cough, it kind of makes your stomach lurch a little bit and get a little tense. It's hard not to think of the worst.
Horse breeder Valerie Arcand has high hopes for her 7-month-old Arabian colt, Major Marshall. She hopes to show him at the Nationals, but a recent leg injury may threaten that dream.
He has a puncture wound just above his knee on one leg.
Valerie is anxious to find out if the festering wound has developed into a serious infection.
Why don't we have a quick peek at him?
Surgical resident Dr. Erin Fearheller and vet student April Chappell arrive to assess Major Marshall's leg.
It's a little nerve-wracking. My background is all small animal, so I can deal with a fractious cat, but a rearing horse is something quite foreign to me.
It's been 2 weeks since the injury, and the open puncture is now swollen and seeping fluids.
He could have a foreign body piece of wood or a piece of wire or anything in there, and that's why it's not healing over.
If left untreated, the wound could become a source of infection for Major Marshall's entire body.
The body's unable to get rid of it, so it just sits there and festers.
Don't go too far over here.
They attempt to probe the wound for a foreign object, but the foal is too jumpy. They decide to see what they can find with x-rays.
I brought him around into the breezeway, and he got quite anxious. It was a little scary.
Pam the dairy cow is on her way to surgery. One of her 4 stomachs is dangerously displaced. Vet student Evan Orchard grew up on a farm, but this is new territory for him.
This one is hands-on. You're doing most of the work. It's kind of nice.
Dr. Fearheller oversees the operation.
That's the biggest thing with students learning how to do these surgeries, is to get exposure to what the normal anatomy is and to realize where it displaces and how it displaces so they know how to correct it.
Once Pam is given a local anesthetic, Evan gets set to make the first incision.
So you just want to go off through what layers you're going through as you go through them?
Going through skin right now.
Okay.
Inside the cow, Evan feels his way around to the other side, where one of Pam's 4 stomachs has relocated.
And a great big gigantic inflated ball on the other side.
The inflated ball is Pam's wayward stomach, full of gas.
So what we've done is we've taken a needle basically like this that's attached to the end of this hose. We've placed it on an angle into the abomasum, and so we're decompressing all the gas that's distended out of it. It's getting suctioned into that bottle right there. Can't you see all the gas in there?
Once the stomach is deflated, Evan works it back into its proper position.
So try grabbing on that and pulling it out towards the incision gently. If it doesn't want to pull.
Evan must carefully reposition the stomach without tearing the tissue.
And it does rip quite easily. All right, let's have a listen to you.
Now this is going to be a challenge because he's shaking so bad. He's really nervous on the table.
All right, sweet pie.
Diane listens for a wet cough that could indicate Tucker has a buildup of fluid in the lungs, triggered by heart failure.
He does still have arrhythmia, but he doesn't seem to me to have pulse deficits, so I'm not particularly concerned that his heart is weak.
The lungs sound pretty good too.
But will instructor Dr. Sue Taylor agree with Diane's assessment?
I just want to listen and feel his pulse at the same time, make sure all those beats are going through. They're very irregular. Just listen to his lungs. It really sounds pretty good.
We were happy to find that his lungs did not sound wet. So we were pretty certain after examining him that he wasn't going to be in heart failure. So that made us very happy.
But the cause of the cough remains a mystery.
He's an old dog. We could find that he's got cancer in his lungs that's unrelated to his heart, and of course, that wouldn't be a good thing to find either.
A staff veterinarian leads the excitable colt into the x-ray room.
We can't tell 100% whether or not there's a foreign body in there. We suspect it because the wound's not healing, that there might be a piece of wood or something in there.
They decide to surgically probe Major Marshall's leg to make sure they haven't missed anything.
He's just being induced right now, knocking him out for surgery. Induction and recovery can be somewhat violent in horses. They can injure themselves, so it's best to be in a padded, closed room.
They have 2 ropes that people hold on either side to try and direct the head. But they're mostly just left to fall because you can't help them down. You can end up getting underneath a 500-kilogram horse.
Operating on horses in a prone position is risky, placing tremendous pressure on both the respiratory and circulatory systems. But Major Marshall's frisky disposition left the medical team with no options. Coming up, a quarrelsome cat with a painful problem.
Oh, you have a big swollen cheek, don't you?
Tell what you're holding on to.
The vet team is performing surgery on a cow with a painful, displaced stomach. Student Evan Orchard gets some help moving it back into its proper position.
When you've never done it before, you don't know how much pressure to apply. You don't want to apply too much because you can cause bruising, and you don't want to apply too little because it basically comes right down to inexperience.
So this was over on the other side, and we've pulled it underneath the room and onto this side again.
The final step is suturing the stomach to the body wall so it won't wander off again. While Pam recovers, Evan reflects on his first experience performing this surgery.
Adds to your experience. The more experience you have, the more comfortable you're going to be with surgeries in the future. So we can look back on this and say, oh, this is how I need to do this surgery.
As for Pam the dairy cow, she's out of pain and on her way home. Major Marshall is anesthetized and ready for surgery on his infected leg wound.
We're just going to raise the table up so we're not crouched over for the surgery.
Moments before surgery begins, vet student April Chappell finds herself in the hot seat.
Dr. Fearheller just asked me a couple minutes before if I wanted to do it. Yes, I would. So it was good. It was a nice surprise.
So what would you like? Scalpel? Okay.
The mysterious cough of 15-year-old Tucker has everyone worried. Heart failure has been ruled out as the cause, but it still could be lung cancer or an enlarged upper left heart chamber pushing on his trachea. X-rays should give the team a clear picture of any heart or lung problems.
We look for any sign that his left atrium has enlarged. That is usually what causes a heart-related cough. And we'll also want to be looking and assessing his lungs at that time.
That doesn't look like he's got a big left atrium to me.
Neither Diane nor Dr. Taylor can see any signs of cancer or heart disease.
I don't think his cough is a serious thing right now.
Come on, buddy.
For Diane, treating Tucker has taught her a valuable lesson.
Never assume. It's a good reminder that you need to be open-minded and don't make snap judgments, because in this case, it's not heart-related.
Hi, guys. He's all there. There's my boy. Hi.
Oh, are you happy now?
Very good patient.
Yes,
It's very easy to work with.
I can't explain how worried I'd been. I was so, sure that there was something major wrong with him, and especially at his age, So you take him home and just love him to pieces.
Minutes into probing the wound on Major Marshall's leg, the team comes up empty.
So sometimes with these we find big chunks of wood, we found antler, we found pieces of hoof wall or wire.
Latches?
All sorts of fun things, but this one hasn't been quite as rewarding.
There may have been something that maybe worked its way out, but there was something there that started it. We just weren't able to find it.
Yeah, we're just gonna finish flushing and then we're done.
Although no foreign body is found, the wound is cleaned of any infected tissue and treated. A quarrelsome cat called Mr. Bink is becoming a regular visitor at the emergency ward.
Mr. Bink got in a fight, as he's been doing for the past 2 months now, and he got a cut.
Ever since first-year vet student Erica Anderson moved, her cat has been busy trying to establish himself in his new neighborhood.
He's used to being the king. Like the last neighborhood we lived in, he was undisputably the big boss, but he has to keep fighting to secure the position. No doubt.
Fourth-year student Tara Hootie is concerned about the swelling on Mr. Bink's face.
Oh, you have a big swollen cheek, don't you? Yeah. It's quite firm. Yeah, it is. And you have a scratch.
What I'm guessing is that it probably is an abscess, but you can't tell for sure.
As a new vet student, Erica is keen to observe the techniques used to treat her cat. Small animal intern Dr. Sharon Finster welcomes the help.
Hi, how are you doing? I've seen this cat before, haven't I?
About 3 weeks ago, yeah.
Hey, handsome.
Cat bites are different than dog bites in that cats tend to bite and impregnate the deep tissue with a lot of bacteria, and then you end up with an abscess.
So I'm going to try to stick a little needle in it and see if I can actually discern a little pocket. Okay.
The vet team needs to determine whether the swelling is caused by inflamed tissues or an abscess dangerously close to the eye. Coming up, how to look for porcupine quills on a young bull. Major Marshall is recovering from surgery, and his wound is beginning to heal. He's ready to go home and hopefully onto a career as a show horse.
I'm glad, yeah. So just get him home and get him back into his regular routine with horses that he knows, and that'll be part of the healing. Horses, you have to keep them mentally happy.
In the small animal clinic, Dr. Finster and vet student Tara Hootie confirm the cause of Mr. Bink's swollen cheek.
Did you see that? Yeah, that's an abscess.
It's painful. They get quite a fever from it, and it can make them very, very ill.
Dr. Finster gives Tara the go-ahead to perform a lancing procedure.
You want to just go through the skin. We're going to lance it and just make a good enough opening to squeeze all the schmutz out. The proximity to the eye makes me a little bit nervous.
You're being such a good boy.
There are quite a few nerves that run in that area, and if you damage those nerves, you can wind up with facial paralysis. They can have difficulty eating.
You'd want, ideally, the cat to be quite sedate so that you don't have to risk injuring any important structures.
Tara must work cautiously but quickly. The sedative wears off in 15 minutes.
How old is he? He's 4 years old. Okay. Today we have a case coming in, 4-year-old Angus bull, I believe.
Vet student Curtis Lutzy gets the case history from the bull's owner, Don Whitehead.
Last night I was over watering my bulls. I noticed one with a lot of porcupine quills around his right eye, which to me was very strange. I'm used to taking them out of dogs, but not out of bulls. Believe it or not, he doesn't have the right name for his personality. We just call him Bully. You know, he's a pretty quiet guy.
Quiet he may be, but any bull attacked by a porcupine is bound to be a little testy.
Any kind of bull, we're usually concerned they're going to be a little bit rank, so we had some sedative available just in case.
When Don found Bully with a face full of porcupine quills, he took matters into his own hands.
I had to pull very close to the skin, and I thought I missed a few, so I called and said I was bringing him in just so they could check him over, and I'm sure there's a few broken ones in there.
Okay.
Faculty clinician Dr. Chris Clark works with Curtis to double-check Don's handiwork.
Mr. Whitehead must have taken out somewhere in the region of 20 or 30, and you know he took them all out apart from that very small little portion.
If there are quills left buried in Bully's head, they could travel and cause more serious problems.
Being around the eye, it's important to get any quills out because they can get an abscess that could cause blindness.
Student Tara Hootie drains the abscess on a cat's swollen cheek.
That's it? Okay. What a mess. So the pressure of all that must have just, would have been very painful. Oh, wow. That's a lot.
So we just basically flush out the wound just to make sure you're trying to get out all the bacteria, the pus that's in there.
Oh, still some pus.
Yeah.
Oh, quite a bit.
Yeah. That's good. We're getting it all out.
That was gross, but it's a little bit harder watching something like that on your own pet. You know, you see it on other people's and you distance yourself.
So now, once he's awake enough and well enough, he can just go home on some antibiotics.
Tara did a very good job of lancing and flushing the wound.
He's a little dopey. I think he did pretty well. He kept his claws in and he didn't really try and bite anyone.
We're going to be in so much trouble when he wakes up.
He's amazingly quiet.
The vet team feels for deeply embedded porcupine quills in 4-year-old Bully's head.
I honestly think that they're all out of here.
To be certain, Dr. Clark decides to shave a bit further back.
Uh-oh, we got one. So far discovered one quill. We'll ultrasound it just to see what it looks like. We'll try to find some more.
The ultrasound confirms only one quill remains.
Clerk, do you want to do the honors then?
Okay.
That's all there was to it?
Yeah. Nothing left of it, really.
We're just going to clean him up and we're done. It's because the bull's so quiet you can actually work on him.
This is way easier than any dog that I've done.
Owner Don Whitehead isn't surprised. After Bully's father was treated at the college last year, he says it's a simple case of like father, like son.
His father was very quiet too. He fell right off the table, the bull. Well, and everybody was ready to start running. Well, he just stood up and looked around and headed for the trailer, you know.
Gentle Bully follows in his father's footsteps. Rather than charging, he meanders his own way back to the trailer.
That's it. It's nice to see the owner so interested and, you know, taking such good care of his animal.
I have lots of experience here being a dairy farmer for 20 years, so I've been here many times. It seems like I got most of them out. Like I say, they got a couple more and should be fine, hopefully, you know. Other than that, now the only painful part will be the bill. No, it's not that bad. I can't complain.